It's U of L Today on 93.9 The Ville. Here's your host, Mark Hebert.
Welcome to UofL Today with Mark Hebert on 93.9 The Ville. You'll stick around for the next half hour or so for the show that's all about the University of Louisville and all the great things going on at UofL. What do we got coming up on the show today? Well, they've built a robotic hand for a child who was missing his fingers and made a wheelchair for dogs without hind legs. Now, a pair of UofL researchers are looking at ways to make healthcare facilities more accessible to patients with spinal cord injuries and those in wheelchairs, and we'll talk to them. But first, Dr. Erica Sutton is a busy woman who has many hats to wear. She's the Director of Community Engagement at UofL's Medical School, as well as the Assistant Dean of Medical Education and Clinical Skills. She also practices a little medicine herself with UofL physicians and as Chief of Surgery at Jewish Hospital. So she has her fingers in a lot of things going on at UofL. And we're going to talk about several of them. Welcome, Dr. Sutton. Good to see you.
Thank you. Good morning.
And you've also got 2 children, too, right?
I do. Absolutely.
So how do you have time for any of this stuff?
You know, my father was a human resources manager who taught me about time blocking.
Time management.
Yeah, absolutely.
So your dad taught you that? You didn't have to learn that in college, huh? Well, let's talk a little bit about your time. The first thing I want to talk about is what you do that is called Surgery on Sunday. What is Surgery on Sunday?
Thank you so much. Surgery on Sunday is a program to provide free outpatient colonoscopy and surgical consultation and procedures for people in our community who are uninsured or underinsured, meaning they can't afford to pay their premiums.
Right. And are there a lot of folks that you've done these surgeries on?
Absolutely. So over the course of about 3 years, we've been referred about 500 patients. But equally impressive, I think, and a testament to the volunteerism here in the city is that we have over 500 volunteers who've joined us so far.
So you've had 500 volunteers do 500 surgeries in the last however many years is it?
We've done about 100 surgeries and then about another 199 colonoscopies for 500 referrals.
And these people are just folks. How do you even identify these people? Do they just walk into UofL Hospital and say, "Hey, I can't afford. I need that. I know I need this surgery, but I can't afford it," and they turn to you?
So the first thing I'd like to represent is that these people are us. They are people who work. People who may be in between jobs or who really are just underinsured. And so if you look at both the category of people who don't have insurance or who can't afford insurance that is available to them, that's actually about 30% of our community. It's a surprisingly large number. Right. And they come to us from a lot of different places. So some of them are referred directly from individual providers. Some are self-referred. We accept self-referrals. And some of them are referred to us through free clinics here in the city.
And where do you do the surgeries? Is it at UofL Hospital or Jewish or wherever will give you an operating room, or how's it work?
Well, we're very proud of the fact that every hospital system in Louisville has agreed to be our partner and several of the ambulatory surgery centers.
Wow. And
so we provide this care in the same place that we provide care every day of the week, and every hospital is one of our partners.
Is it just the basic stuff like some laparoscopic surgery that we're talking about? Are we talking about some really, heart surgery, open heart surgery or stuff? What are we talking about here? What's the range?
Our complexity is increasing. So right now we started with outpatient surgeries, but we have had occasion in which people need to stay overnight. And we certainly have helped them both work through the process of getting approved to have a free surgical procedure as well as a free hospital stay. We do things like hernia repairs and, removal of the gallbladder, but we've also treated skin cancer, melanoma. Mm-hmm. We've taken care of very complex defects of the abdominal wall and cavity that have required multiple overnight stays. We haven't done open heart surgery yet.
You haven't done that yet?
Not yet.
Well, let's hope you don't have to.
Let's hope so.
We're talking with Dr. Erica Sutton, who's with UofL Physicians and Jewish Hospital and University of Louisville Medical School, and as we mentioned earlier, is wearing 57 different hats, and mom as well, right?
Absolutely.
For the surgery on Sundays, is it always on Sundays, or is that just a catchy name? Or do you get these doctors to come in on their days off on Sundays to do the surgeries?
It started on Sunday,
Okay.
but now we do provide service during different days of the week. So we have clinic an outpatient surgical clinic that takes place on Wednesday. And more often, we have providers and hospital systems that are providing this care during regular business hours, Monday through Friday.
Well, good for them. And the number of folks that are needing free surgery, has it gone down with Obamacare?
So, we really thought if there's no need for this program, just let us know. And we're happy to not do that. And what we found in our community was a significant number of people who were still ineligible for federal forms of insurance coverage who needed help, as well as premiums that they could not afford.
So you've still got a bunch of folks walking through the door. Even though they've got coverage, it may be catastrophic coverage or worse that they're getting through Obamacare. Is that?
We have grown every year of our existence.
Is it just because the more people are aware of this, or do you think it's because there are more people that really need the free care?
I think that the need there has stayed the same. There's an awareness of the program that has increased. Certainly I would contribute some of that to that. But I also think that we thought that everyone was going to be insured, that was going to be the answer. And what we found is that, we still have to work through that for our country. We're still working through universal coverage.
So everybody's working for free, is it? I assume, is it?
Everyone is volunteering their time. We now have 2 part-time employees, so we do pay them,
Okay.
but everyone else is a volunteer.
And the students that are medical students at the University of Louisville, do they also participate in this?
They participate to a great extent. In fact, they have been fundamental in seeing this program get started and establishing our sustainability in the community.
Well, I think I saw something. I saw this press release. UofL surgeon and students improve access to colon cancer screening, and you got an award, right?
Absolutely.
So explain that.
We're so proud of the award that we received from the National Colorectal Cancer Roundtable. That's an organization that was formed from the CDC and the American Cancer Society, and they recognized us as their 2017 honoree for our work in preventing colon cancer. Our student roles are through every part of the organization. We have a medical student who serves as our medical director. That's Sam Walling. We have students that serve on our board of directors that really serve as clinic liaisons from our different referral sources, and they actually provide care to our patients in the clinic. And so they really have touched and positively influenced every aspect of what we do.
We're talking with Dr. Erica Sutton from UofL Physicians and the University of Louisville Medical School. You are the Assistant Dean of Medical Education and Clinical Skills. What does that mean? What do you do in that role?
Well, really, we have started developing our curriculum around the specific things that doctors learn to do in medical school. And so certainly we know a lot about, the medical knowledge that it takes to be a physician, but we really have to be deliberate in the skills, including patient interviewing, communicating to others, and then the more technical things that you do with your hands as a physician. And so I work on that part of the curriculum.
So you know all about the Sim Lab.
I know a lot about the Sim Lab.
We just did a story on that for a Great Day Live on WHAS a couple of weeks ago, and we really got a kick out of going down there and seeing the robots that are almost lifelike.
Absolutely.
So kind of describe to someone who's doesn't know what we're talking about, the simulation lab, describe what it is and what you would see if you go in the simulation lab.
Well, the simulation lab is an environment for doctors to practice before they reach you as a patient in the hospital.
Good. We want them to practice before they reach me.
And the more skilled they become, the more real the practice environment needs to be. And so what you were able to observe was our human patient simulator. Now, really, it's about 1.5 times the size of an actual human. It's about $1 million. It's about $250,000, but the set of 4 that you saw in the lab represents about $1 million investment for this training and education. And it's a very fancy computer. It's a computer that can cry. It's a computer that can bleed. It's a computer that can breathe and even talk.
Yeah, we noticed the talking kind of freaked us out when we first got there. We're taking some video, and the little robot thing is talking to us. Whoa, that hurts. I'm going, no, how do you know that hurts? You're a robot. But yeah, it was really interesting, and the students did seem like they were getting something out of it. And also in the sim lab, there was the day we went at least, they had a human patient there that was pretending to have some abdominal pain, and they had to go through that. So it's a practice lab, essentially, for medical students, isn't it?
Exactly. And as I've said, when someone gains more experience, they need a more lifelike and more real environment. And that's why we have standardized patients. So our standardized patient program is led by Carrie Bonert and is absolutely one of the flagship aspects in our simulation training, in which we have actors and actresses who portray different conditions or illnesses or portions of a patient's history that are meant to challenge and train a student in either their communication skills, their physical examination skills, or their clinical reasoning and diagnostic skills.
Are students in medical school, and specifically at UofL's medical school, getting better training than you did when you went through medical school?
I am continually impressed with the breadth of information that they have to cover. And as science moves on and we know more, then it is expected that your doctors are going to know more. So do I think that it's better training? I think it's more in depth. I think it is more deliberate. I think they have to focus specifically on types of communication skills and their body language and their nonverbal communication.
Bedside manner?
Absolutely. I think they have to now come out knowing a little bit more about ultrasound than certainly I had to learn as a student. And so absolutely, I think students, and specifically U of L students, are very, very well trained and probably better trained than that we were offering in 2001.
Yeah, probably so. Community involvement, we talked a little bit about it with the free screenings and the free surgeries that you've got students involved in. Is that part of their training? Is that in the syllabus, for lack of a better term, that they have to do some community involvement and some community engagement as medical school students before they get out?
Absolutely. All of our students are required to participate in what is called service learning, which we realize that you're a learner, but we also think that in that role you can still be of great service to your community. And so that is what they participate in. I'll tell you, our students also participate in something called Community Engaged Scholarship, which is how do we use some of our scientific principles or our research abilities to solve problems in our community and report those back such that we can positively influence the community that we live in together.
Well, we have been just incredibly impressed with the students we've met and interviewed down at the medical school. So let me kind of wrap this up and ask you, what are the challenges going forward that you see in medical care in our community? What's the biggest thing that you see in our community and for the students who are getting out of medical school and are going on to become doctors from U of L?
So the challenge in medical care relates to the challenge in medical school, which is there is an ever increasing need, body of knowledge and skill required, and it really still takes a long time to make a good doctor. Mm-hmm. And so I think that the challenge in the medical community is getting enough providers of adequate and complete training to provide the care that we need.
It's a doctor shortage.
To be as healthy as we can be, absolutely. Okay. Is to really look at the doctor shortage. And to not work in conflict, but with physician extenders to really provide that care.
Gotcha.
So I think that is the sort of community challenge, but also because it takes a long time to make a good doctor and you still need doctors, mm-hmm. it's putting all of that information into a time frame that is both palatable to students.
So you don't have to go to school for 15 years or whatever to become a surgeon.
Yeah, to people who are looking to work in that space.
Yeah.
But also so that it's efficient to meet the doctor shortage and meet the need of our community.
All right. Well, keep juggling all those balls in the air. We appreciate you being at the University of Louisville.
I love being here.
Keep on keeping on.
Great. Thank you so much.
All right,
Mark.
Dr. Erica Sutton, thank you very much. Gina and Karen Frost-Bertocci are both bioengineering professors in the Speed School of Engineering at the University of Louisville, and they've taken what they know about engineering and been applying it to the field of medicine. We'll talk about that a little, as well as a study they worked on that looked at accessibility for spinal cord patients, and they're both here with us now. So, hello, ladies.
Hello.
How you doing, Mark?
How you doing?
Good to see
How you
you
doing?
again.
Good to see you too. We'll talk in a little bit about some of the interesting things you guys are working on. But first, I want to talk, Karen, about this study that you all did, this paper you all did about accessibility for those in wheelchairs into healthcare facilities and the accessibility they have for healthcare facilities. So why don't you tell us a little bit about that study?
Okay, so we conducted a study. It was a two-pronged study to look at the challenges that wheelchair users have when trying to access healthcare. In one aspect of the study, we we conducted site assessments in around regional clinics within the Louisville area. In the second part of the study, we conducted a nationwide internet-based survey among spinal cord injury and all wheeled mobility device users. So all wheelchair users, including a subset of spinal cord injury wheelchair users.
So how many folks you talking about here that you surveyed?
432 wheelchair users.
Participated in
We
our
surveyed.
survey.
Okay.
Yeah. So
Okay.
And 30 clinics we evaluated in,
Oh, wow.
in the region.
Okay, so that's a bunch of folks and a bunch of different places here in Louisville that you went around and,
Absolutely.
and assessed.
Yeah.
Okay, so what'd you find?
Well, what we found was, it's 25 years since the ADA was passed, and wheelchair users are still finding challenges and barriers to seeking healthcare in facilities. So they're not only having problems getting in the door of the building, they're encountering difficulties trying to navigate throughout the clinic or the doctor's office, and when they get to the examination room, the problems get even worse.
You wouldn't think that would be the one place on earth that they'd have a pretty good experience and pretty easy to get into, right? As a healthcare facility.
Exactly, and of course, the Americans with Disabilities Act mandates that wheelchair users should have full and equal access to healthcare facilities and to healthcare in general.
Right.
Which includes both public and private facilities, clinics, and physician offices.
Okay, so I'm a person in a wheelchair. What are some of the challenges that you found in particular? Just getting in the door, getting access by phone, making perhaps a appointment. Was that a problem? I mean, kind of things like that I might not even think of as a fully abled person.
Yeah. Well, we certainly found that starting right at accessing the building or the facility where the clinic was, wheelchair users had problems. About, I think it was about over half of our participants indicated that they had difficulty getting into the door of the facility. So that would be, issues like not having an automatic door opener, for instance.
Or a ramp or something like that
Right,
leading up
or
to
a
the
ramp,
okay.
exactly. But once they got into the clinic, they had problems getting through the clinic doors and then also getting into the exam rooms. Once they got into the exam rooms, they had difficulty with being able to gain access to the exam table. Usually you'll find in a doctor's office there'll be a height adjustable exam table.
Oh, yeah.
And in many cases, those just did not exist in the facilities that we surveyed.
Is it just because you're talking really old school places, medical facilities, or?
I wish we could say that regionally, a lot of the health facilities that we visited and conducted measurements and assessed all of their physical spaces were relatively new. Some of them were even constructed within the last 20 years. So after the ADA was put into place. As Gina said, one of the issues was within the exam room. That is actually where we found the most problems for wheelchair users. They couldn't get into the room. Once they got into the room, they couldn't get anywhere near the exam table, and the exam table typically was not one that they could transfer from their wheelchair onto the exam table. So for you or I, when we go to the doctor, if you have a cold, you may just sit in your street clothes in a chair and talk to the doctor, and you're trying to get a prescription or an antibiotic. In the case of a wheelchair user, they may go to the physician for a general complaint, but when the complaint needs to be examined with a physical exam, so say you go in with a stomach ache or abdominal pain, you may start out sitting in the chair in your street clothes. You talk about abdominal complaints, doctor's probably going to say, hey, step up on the table, let's take a look. Can't do that when you're a wheelchair user if the exam table is, at the 4-foot level. So,
Or if you can't transfer from
All
your
right, get out of your wheelchair
Right.
onto the table, right?
Exactly.
And now the ADA requires that they're able to access equal access to accessible exam tables. I know I'm twibbling that up in my language here, but if you can't get the wheelchair patient cannot easily get onto the exam table, then the medical staff or the clinical staff are supposed to be trained and willing to help that person get onto the exam table. So we found problems in both areas. I think it was almost 90% of the clinics we investigated did not have an accessible examination table in any place in the facility. They only need to have one room where you can have an accessible exam table.
Is that a requirement by law?
The height adjustable exam tables are not necessarily,
Right.
but what the ADA does say is that you have to have equal quality of care. So
Okay.
that if you you and I are able to be examined on an exam table such that we will have a quality exam by the physician, then that's what a wheelchair user should have as well.
Okay. And you said you found 90%, Karen, you said 90% did not find that there was accessibility. So does that mean 90% of the facilities you went in did not have at least one of those tables that would go up
That's
and down?
correct.
Correct.
That's
Wow.
correct.
Yeah.
Okay.
Yeah. The other thing we found too that was interesting, Mark, is that of course, whenever you go to a physician appointment, one of the first things that a physician or their staff will do is ask you to step up onto a weight scale, and that's certainly from the standpoint of being able to monitor your health care, or are you gaining weight, losing weight, which would indicate that perhaps there was a health problem. But also that's very important whenever the physician is about to prescribe a medication for you. So it's dose dependent.
Right.
So, but what we found in our study is that many of these facilities are not able to accommodate in a way wheelchair users. And that obviously has consequences to providing, again, quality health care.
Yeah. We've talked to wheelchair users who say that they have not been weighed in 10 or more years. So they are not aware of their own weight, and obviously then the physician's office isn't aware. And they're often asked to guess about how much they may weigh.
Wow. And they have they have measurements at home? Do they have a scale at home? I assume none
Most
of them
likely
do.
not.
Yeah.
Most likely not.
Okay,
Yeah.
most likely not. Or
typically
don't, I mean, yeah.
You're gonna rely on your physician
Right, right.
to be able to provide you with an accurate weight. And so we found that 82% of facilities did not have scales that were able to weigh wheelchair users.
We're talking with Gina Bertocci and Karen Bertocci from the Speed School of Engineering, and they are bioengineers. And as we've been talking, they're talking about their study that they did on handicap accessible medical facilities and medicine. What did you find in terms of the people that are the total number of people perhaps that are wheelchair bound in the Louisville area? Do you have any idea, or how many there are even in the United States? Does anybody have a number that we can talk about? How many folks we're talking about here?
Nationwide, approximately 3 million individuals require the use of a wheelchair. And we like to use people first language. So you're an individual who happens to use a wheelchair rather than
Okay.
being wheelchair bound or
Gotcha.
something else.
So I did not use the politically correct language, correct?
You did not,
Okay.
but
I'm sorry.
that's okay.
I
We-
apologize to all the individuals who are in wheelchairs. Is that correct?
They
Did I
will
just say that
expect it
correctly?
as well.
All right. So what can be done? What did you have any recommendations that other than spending a ton of money? Is that the
Well,
only option here?
It's not necessarily a ton of money. I think it's
actually
probably
very little.
just a
Okay.
minimal or a modest cost. For instance, we talked a lot about these height adjustable exam tables. You could acquire an height adjustable exam table for probably no more than $1,700. It would be an entry level table.
Okay.
An accessible weight scale, you can get them for as little as $600. So, I mean, these are minor equipment investments that can also be written off, that physicians and health clinics can take the time to invest in. And it's not only helpful to the individual who is the wheelchair user. Think about it, it's helpful to the staff as well. We have an aging population, both of wheelchair users and healthcare professionals. So when you eliminate, say, a lifting requirement, then you are perhaps saving a workers' compensation claim for back injury.
Right.
So it goes both ways. It's just like in the day where we first had wheelchair ramps going into buildings, we found that, they were also very helpful for young parents with children in strollers.
Okay.
So
Right.
doing these things doesn't just help wheelchair users, it helps a lot of people.
And have you taken this paper, or I mean, it's gotten some obviously publicity because I found it, but have you taken this paper to the Jefferson County Medical Society or anything like that beyond this to try and get more folks who are out in these facilities, in these healthcare clinics and other places to install these tables and to maybe widen their hallways a little bit and put ramps on their doors?
We've done almost a half dozen of what we call in-service presentations to various health clinics and hospitals throughout the regional area, including with some of the folks at the University Hospital and in Fraser Rehab. So we've been getting that word out. But from a training perspective of health clinics and their staff, more definitely needs to be done in terms of understanding what the needs of their patient population is.
Okay. Again, we're talking to Karen Bertocci and Gina Bertocci from the Speed School of Engineering. They're bioengineers. And the way I've interacted with them the most is through their work with their students and some of the projects that they've worked on. They've put together a doggy wheelchair. They have a bioengineered hand. We called it a robo hand for a little boy that did not have, I think, his right hand. Was he missing his right hand?
Right, he was actually he was missing the fingers.
Fingers, right. And so they put together hands so he could throw a ball and shake hands. So what are you working on now with some of your students and some of your grad students? You got any great projects?
We've got a lot of interesting projects going on in the lab, Mark. As you know, we also do work in the area of pediatric injury and being able to detect child abuse. And in that area, what we find is in cases of abuse, falls are often a falsely stated cause for abuse. So in our lab, what we're trying to do is to understand as much as we can about falls and the types of injuries that really do result from falls so that we could use that to be able to help to delineate between accident and abuse. So we're doing a lot of fall studies using crash test dummies, if you will, computer simulation. We're also doing both bone health studies involving children. Following up on some of the veterinary work that we've done, we're now looking at dogs that have naturally occurring disc herniations that present very similar to spinal cord injury in humans. And what we're doing is we're looking at how those dogs recover following surgery for disc herniation or spinal cord injury. And we're following that recovery so that we could better understand what we need to do from a therapeutic standpoint and also from a rehabilitation standpoint.
All right, so we're working with animals and humans.
Absolutely.
We're in the bioengineering
Animals and
labs.
kids.
Also working with children with spinal cord injury, spinal cord injured children down at Fraser Rehab with some of our colleagues there, looking at outcomes following activity-based training and beginning to enter into conversations with colleagues at the local Veterans Administration to talk about helping them identify some of the challenges going on there in terms of healthcare accessibility.
Well, this whole meshing of engineering and healthcare and medicine is just fascinating to me. That how you're working with folks downtown in the medical complex to come up with solutions for long-term problems in our medical field. So
Absolutely, that's what
Yeah.
bioengineering is all about.
that's what it is. That's right. So you're doing a great job, and I know your students really enjoy. I've talked to a few of your students who really enjoy working with you guys. So
Thanks, Mark.
all right.
Thanks, Mark.
All right. Well, thanks for being on the program. Appreciate it. All right. That'll about do it for UofL Today with Mark Hebert. But before we go, a big congratulations to Judd Adams. He's a junior from Hardin County, Kentucky, who won a 2017 Truman Scholarship. There are just 62 students across the United States who win that prestigious scholarship each year, which goes to college juniors with a record of outstanding leadership and community involvement who plan to pursue careers in public service. Judd is the third UofL Truman Scholar in a row and the only winner this year from Kentucky. He plans to attend law school and join the military's JAG Corps. So good for Judd Adams from Hardin County, Kentucky. You can hear UofL Today with Mark Hebert every Monday and now Wednesday nights at 6 on 93.9 The Ville. You can also watch the programs on Metro TV, which is Louisville's government access channel, and KETKY during the week. I'll see you Monday mornings at 9:30 on WHAS TV's Great Day Live with a new story about research, students, or something cool going on at the University of Louisville. So thanks again for listening, and go Cards.